All right, crim 28, let us knock out whatever chapter this is. It doesn't tell me right here. It's chapter 5. Chapter 5, case management using risk needs responsivity. Doesn't that sound exciting? Yeah, it's really not that exciting, but we're going to get through this because I'm sure it's important. Here are all our learning objectives. Identifying risks and criminogenic needs. Again, doesn't that sound exciting? But they just use big words to they use big words to describe really simple concepts. Criminogenic needs. This is defined in your book as basically problems, habits, or deficits that are directly related to an individual's involvement in criminal behavior. So really, we're just trying to figure out what it is that makes the person a criminal. That's their criminogenic needs. So community corrections departments they both supervise criminals, and so their job is not only to supervise them, but it's also to make them better, to rehabilitate them. So a lot of people think that, the probation officers and parole agents their only job is to go out there and supervise people and throw them in jail and or prison. And obviously, I'm guessing by this point in the class you figured out that's not the whole deal. The concept really is to try and help make them better, as opposed to going out and just locking them up. And now there are probation officers and parole agents that really all they care about is locking people up. Yeah, that does happen. That's not really the goal. But the first thing to do when anyone meets their probation or parole client, as we call them, I know why, I don't know, but we call them our clients, is interview them. We got to figure out what makes them tick. What are their needs and what can I do to address their needs? Research finds, and I'm going to tell you that some of this stuff was tricky for me as I was kind of an old school PO, but research finds that objective actuarial prediction models are more reliable and efficient than subjective methods. Okay, so what they're trying to say here was there was a certain type of interviews that they wanted us to do. They wanted us to ask open-ended questions. So, how did you feel when you were using heroin? And then just let them go. And not say yes, no questions, things like that. They wanted us to get as much information out of the clients as we could with different types of interviewing techniques. We used assessment scales, structured interviews to try and figure out their risk. And by risk, we're talking about risk to reoffend. And, well, basically risk to reoffend. There are different things that we can consider when deciding whether or not a person is more or less likely to reoffend. There are things called static factors and there are things called dynamic factors. Static factors are things that cannot be changed. So a static factor, here's one example of something that could be a static factor. The age that they committed their first law violation. Let's say I was 13 when I committed my first law violation. That is something that will never change. It will never change, right? It's static. It will never change. Dynamic factors. When was the last time you used drugs? It was 1 year ago. Well, a year from now, will it still be 1 year ago? Hopefully not. Hopefully it will be 2 years ago. It's dynamic. That is something that can change throughout time. So obviously we're going to be looking into the dynamic factors as opposed to the static factors. We can't change this stuff. We can change this stuff, right? Does that make sense? This is a risk assessment, and I think there's actually a copy of this in your book. Yes, it is on page 96. And it asks a bunch of questions like, are you employed? Were you employed when you committed the law violation? Have you ever been arrested as an adult? Have you ever been on probation as an adult? There's a bunch of questions, and your answers to these questions will give you a score. You'll have a number at the end, and that number at the end will tell you what your level of risk is. That level of risk will determine what type of supervision you will receive on probation or parole. How many field contacts and how many visits you will have. How frequently you will see your probation officer. Maybe even whether you'll be on a high-risk caseload, a low-risk caseload. If you will have numerous field contacts. If your file will get tossed in a drawer and you will never be seen again. It depends on your risk levels. Now, what we used to do back in the olden days, like when I started with probation, is you kind of just used your gut, your instinct, and your common sense. I would meet someone and say, wow, this person is really messed up. I think I should meet with this person a lot. Or this person seems really violent. I think I'm going to meet with them a lot. Well, now, that's not necessarily the way it goes. You do this little, this thing again right here, that Ohio or whatever risk assessment that your agency uses, and you will see the person only as frequently or as infrequently as their score on this risk assessment says you see them. Does that make sense? So the whole concept of being objective and subjective. Okay, pause here. Now I can't remember where we were. We talked about this. Okay. So effective supervision must involve some sort of a treatment component and or referrals. So obviously, if you think about it, you guys don't really know me. You kind of know me, but I'm no rocket scientist. I'm certainly not a therapist. I'm not a counselor. I'm not a doctor. I am not a substance abuse treatment counselor. I am not a sex offender treatment therapist. So if you can imagine, when I have people on my caseloads, I can't treat them for all this stuff. So clearly I have to refer them to other people. So yeah, so effective treatment and supervision, you have to refer them. My job was basically hand out pieces of paper saying, call this person and get into their treatment program. There was always outside resources, referrals, all that kind of stuff that were made. So principles of effective correctional intervention: be intensive, contain cognitive behavioral components. Now this is the treatment programs that we were setting them up with. Match a program level with client aptitudes. Now this is tough. Imagine you have a client who lives in 5 Points. Okay, do you even know where 5 Points is? Because I don't know where that is. It's in Fresno County somewhere. 5 Points. How many substance abuse treatment programs do you think are in 5 Points? Yeah, maybe one. Am I going to match that client up with the proper program for that client? Other than the fact that it's in 5 Points? Right. So you can imagine that sometimes you got to do with what you have. Offer positive reinforcements. Yes, that's always something that a probation officer or parole agent can do. Require minimum education and experience levels for staff. Teach clients to replace criminal networks with pro-social ones. This is also very difficult. How am I going to tell my clients who they should hang out with, especially if their family members are criminals? Provide relapse prevention and aftercare. Again, great ideas. In a perfect world, this is an amazingly wonderful idea. Very difficult to do. And by aftercare, we're talking about intensive supervision after a person finishes the treatment program so that they don't relapse into their old ways. But again, these are all, a perfect world. Evaluate the program and assess its compliance to the previous 7 principles. So imagine again, you're a probation officer or parole agent, and you are supervising 50, 75, 100, 1,000 people. Do you think you're going to have time to go and assess all your programs and make sure they're doing all this? Right? I know, it's tough. So cognitive behavioral program, this is the therapeutic intervention for helping a person change that is a blend of cognitive therapy and of the mind and behavioral change of the body. Employment assistance, it's very important. And this is one of the things that I really tried to focus on with my adult clients. Get a job, get a job. Having employed correctional clients was one of the best ways to keep them from reoffending. Employment was one of those things that was just absolutely one of those, definitely something that was going to keep them from reoffending. It would be great instruction to avoid locations that may contribute to possible deviant opportunities. Yeah, you can tell them that they cannot associate with gang members. They can't. Again, another tough part of this, though, is you send them to a substance abuse treatment program. Guess who else is there? A bunch of other drug users. So it's pretty tough to try to tell them to stay away from drug users when you send them to a drug treatment program with a bunch of drug users, right? Okay. So working with female offenders, this is can be tough because there are not nearly as many programs available for female offenders because there are not as many female offenders. So trying to find programs for women is even more challenging because there are fewer female offenders and less money is spent on female offenders. So supervision outside of the state. If you move from one state to the other, we have something called interstate compact. And this is where most states have agreements with each other where you can move from one state to another by way of interstate compact, and they do it with adults and juveniles, and they will basically agree to informally supervise other people's offenders. There's a few states, like for example in California, I think Georgia is the one state that does not have an agreement with California. So if you move to Georgia while you're on probation in California, you will not be supervised, and I think California will tell you no, you cannot move there. Eligibility for interstate compact, resident of the receiving state, so you have to actually live in the receiving state. Desire to live with relatives in that state, employment transfer, or relocated due to military orders. Not a lot of people on probation or parole that are active in the military, but it does happen occasionally. And that's it. See that? We made it.